time. Hello everyone. Thank you for this opportunity to present Ukrainian result of work. So we will work together with Vitaliy. I will be twice on this stage. So we start speaking about Ukrainian prep history. My name is Marchenko and I am program coordinator of Alliance Global. So with this information about me, and start with a pilot project in Kyiv. We actually finished this pilot project in Kyiv. In this pilot project, we involved more than 100 clients. It was cis MSM and one transgender woman. So we had 100 annual courses for 1 year. Another criteria you can see on screen, we started work actually on local protocol for Kyiv Aid Center, because at that moment in Ukraine there wasn't any national protocol for PrEP, implementing PrEP. So I will give you main result of the project. To 100 cursors, we involved 48 MSM. In the beginning of the project, we received 8 HIV positive results, also 9 positive results for virus hepatitis, syphilis 21, but only 6 from them were newly cases, and 19 cases for gonorrhea and chlamydia. It means that we involved in this pilot project the most high-risk category of MSM in Ukraine, in Kyiv. We started PrEP with 124 people. One was case we received like in Bible version, so it was HIV positive result. After the start of taking PrEP, it was a window period. So, but client was readdressed to RT therapy. 24 people was leave PrEP program, and this is, you can see the main reason why our clients leave PrEP program in pilot project. Half of them change their sexual behavior, and 6 clients change place of residence. It's very popular reason for in Ukraine, because a lot of migrants go to work on Western Europe, in Poland also. 4 clients just was loose without connection. From one chronic disease was a decision from medical staff to stop taking PrEP. And as I said before, 1 positive result. And next what will be I give microphone to Vitaliy.
It's not a microphone, but okay. Okej. Dzień dobry, dziękuję bardzo, że mamy tą możliwość wystąpić tutaj w Warszawie. Hello everyone, thank you very much that we stay here and have this chance to speak about PrEP in Warsaw. I'm from Ukraine. I'm working in a public health center and in a treatment and prevention department of HIV. So my presentation will be very general about this year project. We call it national. It's not covered by national budget, but it's like national because it's in all part of Ukraine. So information about drugs, we use TDF-FTC generic. Numbers of year courses, it's a little bit less than 3,000 courses. Yeah, sorry, sometimes my English, like, you will feel that you play charades game and try to understand what I'm talking about. Sorry. Territory, we cover all part of Ukraine. Later we will speak about different regions. What we based? We based on a WHO guidelines that we used to create our national protocol. And who is our clients? Our clients is everyone who has high risk to be infected by HIV. We decided to do it because we have a high level of stigma and discrimination in Ukraine, so we decided that our medical facilitators and medical providers will will don't stigmatize people, and if person don't want to say that I'm MSM or I'm like transgender, it's not a problem. Person can explain that I have a risk, tell this doctor about risk, and so it's a model of our project. It's complicated. Drugs, we have drugs funded by Global Fund. Then social support, it's also funded by Global Fund. Then Public Health and Ministry of Healthcare made delivery of drugs, and also like drugs is in our hospitals, and some analysis is covered by a local budget of local hospitals. So we have like this kind of situation. Okay. Clients can go to hospital directly without NGO, but also we know that like majority of clients use NGO, and Allianz Global help us and do advertisement with other partners to create demand for a PrEP. Implementation parts of our project. So it was a distribution. When we made distribution, we analyzed, like we have 3,000 courses that are founded by Global Fund, so we decide how should we deliver it. We calculate numbers of, estimate numbers of people who live with HIV. Then also we think about situation like geography, what will be easy for people to take, and how many people live in different cities. Then I will have a map of Ukraine, and you will see what we did with delivery. Framework. Before June this year, every hospital can provide PrEP. We have a framework that every hospital in Ukraine can use international guidelines if they translate it to Ukrainian language. They should have two guidelines, like in English and Ukrainian, and in a local level they can use it. But after June, all Ukraine use a national protocol and guidelines how to give PrEP. Demand is created with previous pilot project in Kiev, and then we create demand with a social network, like people start to talk about PrEP between themselves. www.prep.com.ua, Roman will tell about that internet site later. Then we have a project, we have some campaign during Kiev Pride. I will also show you information from Kiev Pride. Ukrainian Ministry of Healthcare was the first government organization that officially support Kiev Pride, and our team was on Kiev Pride like officially. And individual advertisement, I will also tell about this advertisement later. Education, we did a lot of trainings, meeting, workshops. Some of you was on our workshop in Odessa, in Kiev, in a different part of city. We also train doctors that would later train other doctors, and to create like a PrEP net. In Ukraine, a PrEP can be provided now only by infection disease doctor, but it will change next year because we have also transformation period in our healthcare system. Then, round table, a lot of workshops, and monitoring. We monitor PrEP. So when we start project, we was sitting in a HIV team, and in my department we spoke what can we do to monitor what's going on with PrEP, but don't do barriers. And in Ukrainian papers, it's like we love papers. So we decided don't do more papers for PrEP, and we only monitor situation with PrEP using HIV medical system where doctors should put information, and then like national level online we saw what's going on. It's problematic. I will tell you also later why, because we don't have rules that they should do it. So some doctors do it like after they give PrEP with the ambulance card, and then in like 2 or 3 weeks, 1 month put information. But we still have information from medical informed system. And call, Skype call and other stuff. Distribution. Ice cream is a Kiev city, capital city. Kiev city, like officially, is like 4 million, around 4 million person. But like I live in Kiev 5 years, and I'm not registered in Kiev, and all of my friends not registered. So it's like about 5-6 million. So in Kiev it's like 1,200 PrEP courses, and now around 500 clients taking PrEP in a 5 parts. It's not a Kiev district. I'm speaking only about Kiev city. And I told you that I will explain a little bit. So on the western part of Ukraine, we don't have it's not a high level of estimate numbers of people who live with HIV, but we decided that this capital, it's Lviv, this city, it will be a capital of in the western part, where people can take PrEP, and it's a very touristic city. Then Odessa, it's a seaside city. They provide they have a lot of estimate numbers is huge, so we gave them around 300 PrEP courses. Yeah, but okay. Our campaign. So it's my team. Actually, it's my 3 colleagues on a gay pride. They have this banner: "Love should be safe. PrEP works. Undetectable, untransmittable." And around 20 persons from the Ministry of Healthcare took part in a gay pride. For Ukraine, it's it's successful. Okay. Also, for 1 week, a government structure changed logo, so we changed our. You can. Well, okay, I will show you later. So it was a heart with a LGBT flag. Then we made flyers, of course, with donors' help, with partners' support. It was a PrEP workshop in Odessa, some banners and flyers for hospitals and for NGOs. Information in Instagram, Facebook, internet resources, some internet papers. And the last one is internet site www.prep.ua. Roma will tell you about that internet website. Okay, what's going on now? We start project in a middle of April, but we have information and start collect information from May. In May it was 300 persons that start PrEP. That was in a line to start it. Then in June, July, you can see it's double, and now it's around 1,200 persons that use PrEP. Generally, we have till next year, we have 3,000 courses, so now it's 41% of clients use PrEP daily. 56% officially are telling hospitals that they are MSM, and 75% men. So we can understand actually maybe MSM is level of MSM is higher, but like I told you before, we don't want to do this stigma. If person wants to say that he is heterosexual, he can. 56% are MSM, then other group is discordant couples, and the majority of these people from discordant couples, it's women and men from a, so it's complicated. Majority of them from it's couples, men and women, but actually we cannot separate if it's a guy going to hospital and told that he's from a discordant couple and he's risk only in discordant couple, but he's MSM. So it's some of people from here, from a group discordant couples, can be also MSM. We have only 1 transgender officially in a medical information system. He's told that he's transgender, but unofficially it sounds that it's around 5 or more person. It's from from NGOs, information from NGOs, but we use only information from official data, and it's a medical information system. Okay, I am limited in time. I want to put more photos of me, but yesterday 1 man did it, so today I decided only 1. I start to tell you about advertisement campaign, and I want to say that actually everyone of us can do self-advertisement without any fund support, without donor support, without partners. You can only do advertisement around your friends and colleagues, and like me, every year I do marathon, and I put t-shirt with PrEP, and next year we'll do same. Yeah, and the last sentence. Yesterday, someone told that PrEP is our freedom. it's freedom, but don't forget that freedom is not about freedom. It's about rules, and rules it's about respect each other. So prep, in my opinion, prep should be it should be respect between clients, NGOs, and doctors. I don't want to, and I don't like this situation when we do prep unmedicalized. I think that it should be less medicalized, but still it's a medical intervention. Yeah, so it's a bad finish, no? Roman, you continue.
Thank you.
Thank you very much. Dziękuję bardzo.
Vitaliy, it was very virgin version of blah, 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 bam, bam, bam. Okay, when we started and PrEP campaign pilot project, we see that a lot of information about PrEP, even in community, is very less or low. Because the main source of information to Ukrainians was friends from US and Europe. So we create or start working on informational campaign based on our website prep.com.ua. Also, like a part or step of this campaign was forming our frequently asking question on our website. And our website was only one for this moment informational portal or informational resource of news about PrEP in Ukrainian and Russian. So it's helped our medical system to receive fresh information about last research in this sphere. We created 3 promoting videos. 2 of them I hope I will show you today. It's very short videos. And we participate in the first Ukrainian documentary LGBT film movie that was promoting on YouTube channel of our TV channel. So at last I saw that views on this YouTube channel under this video was 62,000. So it was like our element of promoting PrEP in Ukraine. And it's our information of website about how many users of our website is in this moment. Because of lack of time, I will not, you can see this position. Only one I would just say about number of registration on PrEP, it's near 1,000 for this moment. We can see in last 3 months that level of registration on our website, registration on receiving PrEP, I mean, is decrease, and I will say about barriers, why the situation we received in Ukraine. So I'm not agree with Vitaliy last sentence about the medicalization of PrEP. So we have different point of view on this position. Our website became a little bit popular in the world, but maybe you will find your country here. I suppose that mostly it's maybe our migrants in different countries that also looking for information about PrEP in the world. Okay. And it's about interest users of our website about Ukraine. As you can see, only one region that we lose, of course, it's occupied territory, Crimea. So we work only on controlled territory of Ukraine. This, as you can see, research, I will not repeat because Vitaliy described this research where the advertising campaign was. So I continue. And this is analytic information about first circle. It's our clients. When you enter the site, we can see 1 minute. Okay. It's our enter the site. You can see from different research where advertising campaign implemented, and it's how it's effective. So I just marked that Hornet is much more effective than other ones. In Eastern Europe, Hornet is more popular than Grindr. So we received it in data information. About our age of our users, the most popular or most effective age, it's 25-34 and young category. So I just mark that most effective registration is in the young category, 18-24. So they most, how can I say, positive on PrEP, to receiving PrEP, to take PrEP. They leave much more registration form to receiving PrEP. It's our LGBT movie that I said before. This film was presented in Pride Week, so we have a huge number of views. It's example of our advertising campaign. In this campaign, we tried to start discussion in our community. So some of the slogan of campaign was very provocative. For example, I betray my husband and no one know about this. So it was a huge discussion inside community because we was like, how can I say, propaganda, not family tradition. That's all. It's another one example. Main barriers. Okay, I will say it's just very similar to Georgian examples because AIDS center, it's like take monopoly about PrEP. So it's the main barriers to clients why we have a decreasing number of registration. It's my message to you, but I don't know, maybe not like condoms, maybe for some medical support we need to receive, but mostly clients would like to read about PrEP, give registration to us, and go to community center to receive PrEP without any bureaucracy in this process. So, thank you, and now I will show 2 videos, I hope.
Бо мені так безпечніше.
Бо з резиною мені не дуже.
Бо я не завжди себе контролюю.
Тому що я люблю темні кімнати. Пара-па-па-пам.
Бо мені завжди мало.
Thank you, and one more.
Through the wastelands, through the highways, and on we'll till my shadow turns to sun rays, and on we'll go through the wastelands, through the highways, and on we'll go.
So, thank you, take care of yourself, take PrEP.